Well, ankle sprains fall into a number of categories. There's grade 1, 2, and 3. You know, we could call them mild, moderate, and severe. I'm not going to go into too much detail about it, but when people have a sprained ankle, some degree of swelling is normal, even in a grade 1 sprain. And it's usually because you pulled some of the ligaments on the outside of the ankle. Your ankle usually most ankle sprains are to the outside where your foot rolls outward. And the soft tissue and the ligaments on the outside of the ankle develop small tears or become overstretched. And you get swelling and pain with that. Usually if the athlete can walk relatively naturally within the first couple of days, it's not a serious sprain and you can get back to activity pretty quickly. The key things with getting ankle sprains evaluated and looked at is to look at the strength of the ligaments and the connective tissues of the ankle to see if the person is stable or unstable. Because if they're unstable, then playing is going to put you at risk of even more serious injury. But if it's stable, then you can get back to activity much quicker. So you want to check for stability. You want to check for alignment and relationship of the bones of the foot and the ankle. And one of the things that a lot of people don't understand is that when you sprain an ankle, the potential of creating an abnormal relationship of the bones of the foot and ankle actually goes up, and it has to be checked in a specific way. And if that relationship is altered, it doesn't always just go away with time or exercise. And by manipulating and correcting that, you can speed up the recovery of an ankle sprain much more rapidly. Because if, let's say, the bones have shifted and are not moving normally, they may be pushing on the ligament and increasing the stretch on that. So it's not getting the rest it needs, and it's under abnormal strain. And then the other thing with ankle sprains is getting a good exercise program so that you re-strengthen all of the muscles of the foot and the lower legs so that they protect the ankle and work more naturally. The last piece of it is that when you sprain an ankle, you have nerve endings in your lower body called proprioceptors. And proprioceptors give us our brain information about position and balance and equilibrium. So when you're running, they're like little computers that are working at like in thousandths of a second and telling your body when to fire a muscle, when to relax, how to balance, and how to work. And when you sprain your ankle, the proprioceptors get altered. So they start malfunctioning. It's like if your computer crashed. And now it's working, but it's kind of not working as good. It doesn't download as well. Well, that happens with our bodies. So when you have an ankle sprain, it's important sometimes to do proprioceptive or balancing or equilibrium exercises to retrain those nerve endings so that the body can react more rapidly and more accurately when you go back to sport and you're less apt to hurt it. So those are the things that we look at when we evaluate for ankle sprains.